चेक कर लीजिए, पूछ लीजिए बहुत सारी है। दो सेकंड रुकना पड़ेगा तभी ऑन होगा, एक बार क्लिक करो बस।
ठीक है, या पहले लिया हुआ। हाँ, थैंक यू। Good afternoon, everybody.
Good afternoon, ma'am.
Nice. I was just fiddling whether I was audible or not. Great. Hope you all are keeping well. So today is somehow going to be one of the the last lectures, though the nerve lesions and all is left. We would be revamping a bit about the initial part that we have studied, that you guys have studied. I'll go with a little recap of what we did, and right, just a bit of revision before we jump on to the joints of the hand. Should I wait for some time? Oh, the students are yet coming. Okay. Good afternoon. I have not started the class yet. I was waiting for the class. The strength is not full yet. Am I audible to you all? I'll start at 2:05. I'll start at 2:05. Not everyone has joined yet. The time for the class is 2 o'clock. Yeah. I hope you all are reading and have gone through a bit of what has already been taught to you.
I had a doubt.
Okay, regarding?
The dorsal interossei in the Gray's Anatomy Students Edition, they have written that the middle finger can abduct medially or laterally with respect to the long axis. Is this the phrase correct? Abduct medially or laterally?
Abduct medially and laterally. Abduction can be lateral, right?
Yes.
Yeah. So I'll check over the same, though I don't think so. I read about something like that. I'll check on that for sure.
Okay, ma'am. And so the dorsal, what kind of movement will occur to the middle finger due to contraction of the dorsal interossei? Because they are on both the sides. So
yeah, the middle, see the axis of the hand is around the middle finger, isn't it? The axis goes around your middle finger. So how will the middle finger move? Obviously there are dorsal.
Yes, that's the doubt.
Yeah. So that is what, abduction goes, there is a contraction, the abduction, the lateral two and the medial two digits, they are gonna move on the lateral side. The medial two will go medial and the lateral will go more lateral, right?
Yes, but they have written abduction of index, middle and ring fingers. So that was confusing. So I'll send the picture in the group once.
I'll see on that.
Okay.
Okay?
Okay, thank you.
Okay, so let's start with today's class. Talking about the hand. Yeah, talking about the hand, you already had a little bit of the things when we read about you had your lecture on the forearm and the hand, and also the front of the forearm, the hand, palmar surface, and the back of the arm, back of the forearm, as well as the dorsum of the hand. Just a little revamp, you know about all these structures already. You read about the creases, you read about the skin creases, the eminences, the hypothenar eminence, the thenar eminence, and the creases which are there, the phalangeal joints responding to the distal, middle and the proximal phalangeal joints, right? And if we, this is again this thing, another recapitulation itself. The bones in the hand, they're categorized into the carpal bones, the metacarpals, and we have the digits wherein we have the phalangeal bones, right? And this image very well shows, this is from student, very well shows about your the axis around which the adduction and the abduction is taking place. Now can you see what kind of an image is this? I'll turn on my camera for a while. Yeah, so can you see me? This is what is described as a resting position of the hand. Resting position matlab there is no effort going on. When you are just resting, how would your hand be? You would not keep your hand like this. You would not keep your hand in the anatomical position, obviously it's down, right? आपका हाथ ऐसे नहीं रहेगा, the hand is not going to be like this. There's a little bit of flexion. There is a position which the hand automatically assumes. Can you try to do that in your hands? When you just keep your hands by the side and you see what is the resting position of your hand. Can you see that? There is flexion at the metacarpophalangeal joints. Flexion at the metacarpophalangeal joints, proximal interphalangeal and the distal interphalangeal joints. But the degree of flexion is more so in the little and the ring, and then more as compared to the index, middle ring and the little finger, right? The thumb over here is not assuming the position that you see in the anatomical position. It's not like this, right? What is anatomical position? That is a hand is by the sides of the body with the palms facing forwards, isn't it? ऐसे तो नहीं रहता. The hand doesn't stay like this all the time. The hand automatically at rest assumes this position, okay? And in this position, if you see, this is the wrist joint, isn't it? Are you able to see my hand clearly?
Yes.
Yeah. So when somebody is talking about what is the resting position of the hand, I talk about at rest, without any effort, how the hand is placed. See, this is the position of your wrist joint. If you see at resting position, the wrist automatically assumes slight extension, okay? Keep your hands by the side of the table or by the side of bed, wherever you are sitting. The hand is like this, okay? Wrist is at a little bit of extension, and the fingers, they are digits, they are having a flexion at the metacarpophalangeal and the proximal and the distal interphalangeal joints, which is more so in the little finger, okay? And also, if you try to move your digits, automatically the movement is more in the little and the ring finger, like this. This is the position, that is the way how you would hold a cup in your hand, okay? I'll talk about this later also. Okay, so you're already versed with the skeleton of the hand as such, right? See, we have the carpal bone. This is the palmar surface of your hand, the skeleton, articulated skeleton. We have the carpal bones, which are arranged in two rows, okay? There is a proximal row of carpal bones and there is a distal row of carpal bones. And just to revamp again, we have, what are the carpal bones in the proximal row? We have four bones, the scaphoid, from lateral to medial if we say, we have the scaphoid, the lunate, trichitrum and the pisiform. If you see from the palmar aspect, you cannot very well see the trichitrum because the pisiform is sitting on top of it. That is, the dorsal surface of the pisiform is articulating with the palmar surface of the triquetrum. And then in the distal row of the carpal bones, we have the trapezium, the trapezoid, capitate and hamate. This very well shows over here the hook of the hamate. Seeing in the hand, appreciate that this is the scaphoid, this is the lunate, this is the triquetrum and this is the pisiform. Trapezium, trapezoid, capitate and hamate. Why I am talking about these all the bones over here is that if you characteristically say all the bones, they do not have a very well defined shape. They are all polygonal in shape, right? And there are, at so many levels, the joints are being formed in between the carpal bones. That is, they will form the intercarpal joints here. The carpal bones are articulating with each other. They are articulating with the metacarpal bones, forming the carpometacarpal joint here, okay? And the metacarpals further articulating over here with the phalanges, forming the metacarpophalangeal joint, and there are interphalangeal joints in between. For the metacarpals and the phalanges, we know that we have the head, the shaft and the base of the metacarpal. The same goes with the phalanges as such, okay? I'll talk about what is the difference in your thumb, okay? In the thumb, that is the first. If I am seeing from the palmar aspect, see, this is a palmar surface of the metacarpal bone and on the dorsum will be the dorsal surface. But this does not stay true for your first digit. The first metacarpal, the palmar surface is facing medially, and similarly the dorsal surface has come to lie on a lateral aspect. See here like this. See my hand. This is the palm. Palmar surface has bit of concavity as compared to the dorsum, which has convexity, okay? This would be the palmar surface of the metacarpals, and over here I have the dorsal. But in the thumb, the palmar surface has assumed a more anterior position. Why would that be? Because of, to facilitate the more number of actions that your hand can perform. Okay, so this is the position where the thumb is lying. The palmar surface has come to face more, come to be the medial on the medial side, and the dorsal surface has assumed a more lateral position. All right. So again, this would now I'll go again to the same image. Can you appreciate it? This is a pisiform. This is your hook of hamate on the palmar aspect that you are seeing over here. Okay. Yeah. So on the dorsal aspect, the same things. On the dorsum, you will not be able to appreciate the pisiform, because pisiform was lying ventral to more on the ventral side on over the trichitrum. This is a scaphoid, lunate, trichitrum, trapezium, trapezoid, capitate, and hamate. Okay, and the trichitrum possibly has the trichitrum assumes a more the lateral position. See, this is what I was talking about, that how the first digit is facing. This is the palmar surface. This would be the dorsal surface. The palmar surface of the metacarpals having more concavity as compared to the dorsal surface. This is your first metacarpal, the second, the first metacarpal, the lateral surface. Okay, it is articulating with the trapezium to form the first carpometacarpal joint. A little revision, that when I said that the palmar surface has bit of concavity, even the way the carpals are lying here, the carpals are basically assuming some concavity, isn't it? There is a slight concavity. Sorry, just stuck. Yeah. Why is that concavity? The carpal arch which is formed, because this is the tubercle of the trapezium and also the tubercle of the scaphoid. I'll show again. And this is how the carpi, they are assuming an arch. They form an arch over here. This is the proximal row of the carpi, the scaphoid, lunate, trichitrum, and pisiform, more ventral, trapezium, trapezoid, okay, capitate, and hamate. Okay. See, this is the thing that your the radius, this is to show that not all the bones are forming, not all the bones of the proximal row of the carpal bones are going to be forming the wrist joint. You just had a class on wrist joint yesterday, isn't it? In that class, you saw that what was articulating, the scaphoid and the lunate were articulating with the radius and also the articular disc of the, but ulna was not articulate, it was only the articular disc which was forming with the radius, and the scaphoid and the lunate, which were forming your wrist joint, right? This is just to revamp the structure why it was like this. Okay, and if I have to talk about all these things here, appreciate that this is the from the ventral aspect, this is the tubercle of the scaphoid, this is the tubercle of the trapezium, okay, and this is your pisiform and the hook of hamate. They form the ulnar prominence here, and on the radial side, radial prominence pillar is formed by your tubercle of scaphoid and the tubercle of trapezium. Okay. You don't have to go into much detail about your the individual carpal bones as such. I just had to highlight the particular features which I showed about the the pisiform, the hook of the hamate, and right. In the scaphoid, just don't go into the detail. Different structure that I am finding over here. This is the surface of the scaphoid which will be articulating. This is a scaphoid of scaphoid over here which would articulate with the radius as a part of the wrist joint, okay, and this is on the ventral, would be articulating with both trapezium and the trapezoid. What I highlighted here is the region of the waist of the scaphoid. And can you appreciate the numerous vascular foramina here? Scaphoid is one particular bone which is most easily fractured. It is most accessible to fracture, and more so not only getting fractured, when the blood supply, the vascular supply to the scaphoid bone is cut, there is decreased blood supply that would further lead to avascular necrosis of the scaphoid. So that is one of the reason why I included the individual picture of the carpal bones. You don't have to go into the details at all, you will not be asked about, just to orient you. Okay, see the pisiform bone, the dorsal surface of pisiform will sit on top of the ventral surface of the trichitrum bone. Okay, similarly you have your trapezium, trapezoid, capitate as well as capitate. Why is it named capitate? Because head shape, the caput, as a caput it is. Okay, it is the largest carpal bone, and scaphoid is the largest carpal in the proximal row as such. Okay, this over here is the hook of the hamate. One thing which was there in the hamate bone to be noticed as such, that there is a notch on the, there is a groove, there is a notched area on the medial aspect of the hamate bone, right? Okay, so another this is just recap only. Appreciate what would be the attachment of the flexor retinaculum. See that what I told was, this is the tubercle of the scaphoid from the previous image, and this over here is a tubercle of the trapezium. This is the trapezium bone. Okay, oh sorry, this is the trapezium, the tubercle of the traphoid, tubercle of the scaphoid. Over here we have the pisiform, we have the hook of the hamate. The pisiform, hook of the hamate forming the ulnar carpal eminence, and the tubercle of scaphoid here with the tubercle of trapezium, they form the radial carpal eminence. Okay, there is one interesting thing here, that there is a groove on the, see, appreciate, this is the first metacarpal, there is groove on the medial aspect of the tubercle of the trapezium. This groove over here is for the passage of tendon of flexor carpi radialis when it attaches to the base of your second and the third metacarpal. Do you remember when it was taught to you regarding the flexor carpi radialis? This is one tendon which perforates your flexor retinacula. It forms an osteotendinous tunnel through which it is passing through the flexor retinacula. Can you appreciate my cursor? This is the position where this is groove for, where there is a groove for on the medial aspect of your tubercle of trapezium. From here the tendon of flexor carpi radialis is passing. Okay, there are two, this is the cross section at two levels, where we have the scaphoid here below, and above we have the trapezia. Okay, this is one of the similar images. I am just revising so that you have a better orientation with all these things. Okay, the same thing I talked before. This was shown to you in yesterday's class on the wrist joint, that this is the inferior surface of the radius, which has two areas, two shallow concavities for articulation with the scaphoid, and laterally for the scaphoid, and medial one for the lunate and the trichitrum. These three bones, right? And this is the articular disc, this is, or the ulnocarpal article disc, forming the wrist joint here. This is to just show that what are the articulation of the carpal bones. Okay, they form, one of the joint is radiocarpal joint. Okay, and very characteristically, when I showed, I was telling you about the rows, I told that the proximal row and the distal row of the carpal bones, there is a joint which we say that it is between the proximal row of the carpal bones and the distal row of the carpal bones. Okay, this is how it has been reflected down. Up, whatever is, something is cut from between and you reflect on two sides. This image is somehow showing like this. Okay, so this is the distal surface, this is the proximal surface of the distal row of carpal bones, and this is the distal surface of the proximal row of carpal bones. Okay, can you appreciate how it has been reflected? So from the proximal row, scaphoid, lunate, trichitrum, pisiform, trapezium, trapezoid, capitate, and hamate. All right, is this clear? Is the orientation clear? How what would be the plane of the mid-carpal joint here, and then hidden over here would be the carpo-metacarpal joint. So I have already talked about a little bit part of about the metacarpals and phalanges in the initial slides itself. This is again from the showing that the joints which are being formed between the metacarpals and the carpals, this would be the carpo-metacarpal joint. Okay, the metacarpophalangeal joints between the metacarpals and the phalanges, proximal phalanges, and in between the phalanges, the proximal and the distal interphalangeal joint. Alright. And now appreciate here the green line in between the carpal and the radius over here. The green line is representing the radiocarpal or the wrist joint, and the blue line over here in between the proximal and the distal rows over here represents the midcarpal joint. Okay, appreciate the two curvatures in this midcarpal joints. I'll come over to this again also, but just try to appreciate there are two curvatures in between, two curvatures with the midcarpal joint line is following. Okay, and on more, there are obviously many intercarpal joints in between. All the carpals are articulating as the intercarpal joints. This is just a revision, a quick revision about all the muscles that you have already done. From superficial to deep on the flexor side of the palm, if I have to go, I have the muscles of the thenar eminence and the hypothenar eminent. First and foremost, I have the flexor vernacular in this image, which has not been cut. I have the abductor pollicis longus, the abductor pollicis brevis, the flexor pollicis brevis, the adductor pollicis. This is the oblique head, the transverse head is a bit deeper. This is the oblique head of the adductor pollicis here. We have the abductor digiti minimi, flexor digiti and opponents. Okay, and you can very well appreciate the lumbricals, the unipinnate, and these are the bipinnate. And what over here is the tendon of the flexor digitorum superficialis. Okay, in the palm also appreciate there are numerous ligaments which are over here. Okay, these are transverse metacarpal ligaments which are over here. You have already read about it. I'm just to orient you again. I'm not going to go into details. Okay, the flexor digitorum superficialis. Once you cut the flexor retinacular, these are all the tendons of your cut out the tendons of the flexor. In this image, the tendon of flexor digitorum superficialis have been cut. Can you see the tendon of flexor digitorum superficialis? It is dividing into two slips and inserting onto the sides of the middle phalanx over here. This is the tendon of the flexor digitorum profundus to attach on the base of the distal phalanx here. Alright. Okay. When I mentioned about your flexor carpi radialis, that it is passing through the flexor retinacula, I appreciate very clearly that this is a tendon of flexor carpi radialis. Okay. It is going through the flexor retinacula, and this is the place when it is going through deeper, it is lying deeper to this muscle, which is the abductor pollicis brevis. Okay, the tendon of flexor carpi radialis is deeper to the abductor pollicis brevis. So in this image, they have also shown that this cut part is the abductor pollicis brevis. Okay, and this is the flexor carpi radialis. Can you appreciate this? This is a cut tendon of the flexor carpi radialis. It is deeper to this, that is the abductor pollicis brevis. So, okay, another deeper down, I have more clear these muscles. Okay, I have opponens digiti minimi here. I have adductor pollicis. This is the oblique head of the adductor. Sorry, this is a transverse head, and this is the oblique head of the adductor pollicis. Okay, so are you not able to hear me? Someone wrote audio breaking. Am I audible now? All right.
Yes, ma'am. You are clearly audible. Yes, ma'am.
Okay. Nice. Yeah. So again, the extensor, you just have done about the extensor compartment, how the tendons are arranged below the extensor retinacula. There are 6 compartments. We have the dorsal interossei here, the right. Okay, so we have the first and the second and dorsal interossei. Just excuse me. Yeah. Okay. Then how the tendons are arranged in the tendon compartments. All right. Why I am highlighting it again is that you have to just appreciate that a muscle is going to produce the action where it crosses the joint. Okay. Like I have the extensor pollicis longus attaching onto the distal interphalangeal. We have the extensor digitorum attaching over to the your proximal and the distal interphalangeal joints, except in the distal interphalangeal joints of the the little finger, where we have the attachment of the extensor digiti minimi. We have the extensor carpi radialis longus attaching on the base of the second metacarpal, extensor carpi radialis brevis on the base of the third metacarpal, extensor carpi ulnaris on the base of the fifth metacarpal, so on and so forth. Okay. The compartments which were formed. Okay, little about it that अभी मैंने बताया था that how the fracture of scaphoid is more common. The most common reason is that when a person would fall on an outstretched hand, again there's a problem with the audio. Someone wrote audio. Am I not audible?
No, your audio is.
Okay, ma'am.
It's quite clear, Dr. Vidhu. Your audio is quite clear.
Okay, ma'am.
Proceed. I think that must be a local problem with one of the students.
Okay, ma'am. So, when I talked about what do you mean by fall in outstretched hand? How would you fall on an outstretched hand? Though you're going to read, when you are about to fall, the usual tendency of a person is just to put the hands down on the floor to protect. That is when the hand is outstretched. You just fall straight on your hand, you are protecting your body. This is one of the reason when your scaphoid bone might get fractured. And I showed you the waist of the scaphoid bone. Most common pattern is that is the region that is actually called the surgical waist as well. Okay. Can you appreciate in one of the x-ray that this is the scaphoid bone here? We have the lunate, the tracheatrium. This is the pisiform. Okay. Trapezium, trapezoid, capitate and hamate. This is the fracture of the scaphoid bone that is seen here. Alright. And also one more thing, I'll show that to you in the video as well, that the trapezium bone, when I said that there is a groove on the medial aspect of it for the tendon of flexor carpi radialis, on the lateral aspect also it is related to your radial artery. Okay, this is a radial artery. This is a trapezium bone, trapezoid here, trapezium, it is related to your radium artery. All the branches which are given here, when there is fractures, there is inadequate blood supply. This is the reason that the bone might go into avascular necrosis. There is inadequate supply, it is not function, that is okay. Yeah, and one more thing I wrote here about the 3 distinct fracture patterns. We have transfer through the waist, oblique fracture which could be a 45-degree angle to the surgical weight, and also through the proximal pole of the scaphoid bone. Okay. This is the image from your student grays only. Appreciate this is a normal x-ray, the scaphoid. This is the radius bone here, the ulna. We have the scaphoid here, lunate, tracheatrium, and can you appreciate the pisiform here, right? Surgical waist is where we have numerous vascular foramina, which is not exactly the numerous vascular foramina. This is a plane where any intervention would be done. Most common area that the scaphoid would fracture, which I had shown you in the image as well. Okay. See, can you appreciate what this is the hamate bone, and this is the hook of the hamate that you see here. If you see your own palms on the medial aspect, you can very clearly palpate and feel your pisiform. I hope you must have already done that. Hand ho chuka hai. You've already read about the hand, isn't it? Were you able to appreciate the pisiform? This thin, the P-shaped bone on the palm on the. Were you able to appreciate? Can someone reply?
Yes, ma'am.
You already had the lecture on the hand before. The palm of the hand, and you go a little more distal, much more deeper flame, just 2.5 centimeter distal to it. You can also feel the hook of the hamate. This will not be very clearly if okay, just doing that. Yeah, can you see my hand? Yeah. So I have a little finger, I have small hands. So this over here would be the P-shaped bone, the pisiform bone here. Okay. Over here, I can at least feel in my hands. You have to feel that. You can appreciate your carpal tunnel. There would be a slight concavity, not the tunnel you will not be able to see, but a slight concavity you can feel here. Just on the medial aspect you will feel a P-shaped bone. This is your pisiform. Going lateral you can also actually feel the scaphoid as well. Try to do that, and from the pisiform you go a little distal over here towards the palm, to the depth of the palm, just 2.5 centimeter depth distal here. You can actually just, you need to press it here, then you can feel the hook of the hamate. And also near the hook of the hamate, when I told that on the medial side there is a groove, you can roll the ulnar nerve over here. I want you guys to do that. Are you able to feel the pisiform bone in your hand? Yeah, just go 2.5 centimeter distal on the distal to that. You can feel the hook of the hamate and try to just move your thumb or index finger, whatever you are pressing it with. उसको थोड़ा सा side में just try to move it. You can actually roll the ulnar nerve in that position here. Okay. Okay. And why it was already read in, I'll come to that before, but pisiform bone, which muscle was attaching on the pisiform bone? Two very important.
Flexor carpi ulnaris.
Yes, the flexor carpi ulnaris, and from the pisiform bone, there are two slips of ligament, the pisohamate and the pisometacarpal. With the help of, it first attaches onto the pisiform, then through the slips, the pisohamate and the pisometacarpal, it gains attachment onto the hamate as well as the metacarpal bone. Is that clear? Similarly, not only the scaphoid as such, the fractures can also happen in the hamate bone. The fracture of metacarpals can also happen. In fact, metacarpal fracture is most common on the outside head. It is also very common in case of crushing injuries, direct blow to the hand, very high energy impact on the hand is there, no? At that time, the fracture of metacarpals happen. The fracture of phalanges can also occur. Fracture of distal phalanx is usually more common, which is seen. Distal phalanx fracture is more comminuted. Comminuted means it goes more into different pieces. Hematoma formation can be there. Okay. This is an interesting. This is also from student grades as such. A condition known as the Kienbock's disease, in which the avascular necrosis. This shows your necrosed bone as such, the dead necrosed bone. Avascular necrosis of lunate bone can also occur in case of fracture of the lunate. Okay, when there is any time avascular necrosis will occur when there is inadequate blood supply. Okay, this is a condition, a term which we have, scapholunate dissociation. Can you appreciate? Apart from the normal X-ray, let me go back to a normal X-ray. If this was scaphoid, this is a lunate. You would not see so much of difference in alignment, right? Can you see that over here? This is the scaphoid bone and the lunate bone, trichitrum and the pisiform. Okay. So this scaphoid bone, there is a sufficient amount of gap which has happened over here. This is also due to your some kind of extensive pulling and pulling of the muscle, that the joint cavity gets more separated in between the scaphoid and the lunate bone. Okay. Coming over, I have already given you a brief introduction about all these joints. We have the intercarpal joints, which I said that they would be in between the proximal and the distal carpal rows. Okay, we have a huge number of joints over here in the hand, in a very small hand. We have extensive number of muscles and joints. Okay, we have intercarpal joints, the midcarpal joints, also known as a transversal carpal joint, which I had shown, and the radiocarpal joint you have already done about it. The carpometacarpal joint, we take the carpometacarpal joint of the thumb as a separate entity as compared to the second to the fifth carpometacarpal joint. I'll come on to that. One thing I've already explained you very well about, that how the thumb is positioned, that how we have the palmar surface of the metacarpals, and how the thumb is positioned in your arm. I hope you were clear about what is the resting position of the hand, what is the orientation of your thumb as compared to the digits in the hand. Please, if you have any doubt, just ask right now, because you will have to go through with all these things when we talk about the movements. You need to be very clear about the resting position, what is the movement of action. Alright, we have joints in between the metacarpal bones, the intermetacarpal joints, joints from the metacarpals to the phalangeus and the interphalangeal, so on and so forth. Okay, as per Cunningham's, it is beautifully described in Cunningham's, if you read, that the intercarpal, the carpometacarpal and the intermetacarpal joints. Just figure out, try to position the intercarpal, the carpometacarpal as well as the intermetacarpal joints. Okay, they assume, talking about all these joints as a single entity, they assume 3 separate joint cavities as such. It is described as a main joint complex, the pisiform joint or the intercarpal joint, and the carpometacarpal joint of thumb as a separate. Now what do they describe about now what was the meaning of that it is written as a main joint complex? First of all, can you appreciate that over here the coronal section of this is the coronal section taken through the hand and the joints. See, I have the first metacarpal and through the fifth, right? This is the proximal row, this is the coronal. You cannot appreciate the pisiform bone in this image, but I have the trapezium, trapezoid, capitate and hamate here. Alright, so why is it what did they mean about the main joint complex? This is just for to the division of the functional thing. They say that this is one complex single joint cavity where it is like we have the intercarpal joints here. Okay, we have the medial 4 metacarpal, we have the carpometacarpal joints, carpal and metacarpal. These are the medial 4 metacarpal bones. Can you appreciate that the joint cavity is extending in between? It's a single joint cavity lined by the synovial membrane. Can you appreciate? It is not continuing with the thumb as such. Please be very clear about this. This is a separate joint cavity which is being described as a main joint complex. They have the synovial membrane and the capsule lining, the synovial lining, which is continuing in all these cavities. This is comprising of your midcarpal joints, your intercarpal joints, and extending on to the carpometacarpal joints of the first 4 digits. While if we see the first carpometacarpal joint, that is separate. I cannot also see the pisiform, articulation between the pisiform and the trichitrum. Okay, the articulation between the pisiform and the trichitrum is also taken as a separate joint cavity. Okay, so in Cunningham's it is beautifully described as a main joint complex, the intercarpal joints, the midcarpal joints and the carpometacarpal joints of the first 4 digits as one main joint complex, the pisiform or the intercarpal joint between your pisiform and the trichitrum, and the carpometacarpal joint of the thumb. Alright, appreciate in this image as such, we have the label, scaphoid label trichitrum. This is from Grant's Atlas, scaphoid lunar trichitrum, and these bones here, the joint cavities. Okay. When we talk about the joints, again this is reinforcement. There are a lot of ligaments which are binding around the joint cavities. We have the so there is an extensive array of ligaments around your carpal joints. Okay, there is no fixed name about how are the ligaments going to be around the intercarpal joints, the midcarpal. They are named according to from the radius to the from the trichitrum to the capitate and all those, how they are positioned as. Okay, we have appreciate here that we have these are all the palmar intercarpal ligaments. Okay, for the wrist joint it was already told to you about the radial carpal collateral ligament, over here, and this is the palmar collateral ligament here from the ulna, palmar ulnocollateral ligament here, we have the radial collateral ligament here. These are all an array of your intercarpal, palmar intercarpal ligaments. Okay, this is the pisiform bone and the metacarpal, the pisohamate, not labeled here but try to see. This is a hook of hamate, the pisiform, the pisohamate and the pisometacarpal ligament. Can you appreciate the cut end of the tendon of flexor carpi ulnaris here? Please see that this is a tendon of flexor carpi ulnaris cut here. The pisohamate, the pisometacarpal. Okay, these are the ligaments which are binding the metacarpophalangeal joints. These are the deep transverse metacarpal ligaments. The first the first digit as a separate joint and entity. We have the ligaments of the metacarpophalangeal as well as the interphalangeal joints. They are roughly similar. We have palmar ligaments here. These are the palmar ligaments. They are similar in the metacarpophalangeal, the proximal and the distal interphalangeal joints. Okay, this is an image, this is a dissection image. Very clearly appreciate the deep transverse metacarpal ligaments. We have our palmar ligaments here, palmar carpal ligaments here. Can somebody tell me why would this green thing, a probe, is being given here? Can anyone orient? This is a thumb, this is a pisiform, this is the hook of hamate. What did I tell you with this is a scaphoid bone, this is trapezium. What did I tell you with respect to the trapezium? This is the tubercle of the trapezium, this is tubercle of the scaphoid. This is a groove on the medial aspect of your, there is a groove on the medial side of the tubercle of trapezium, tendon for flexor carpi radialis. Yes, yes, and this is the lateral aspect which is related to the radial artery here. Okay. This is the ligaments and the joint orientation of joints from the dorsal aspect. Okay. Okay. In this image, it is written that these are the collateral ligaments of the metacarpophalangeal joints. I'll come to that when I talk about the metacarpophalangeal joints. We have number of collateral ligaments, and these collateral ligaments they hold same for the proximal and the distal interphalangeal joints also. Okay. Sorry. Coming from the distal to the carpal side back again. On the carpal side, sorry, this is the dorsal surface of the radius. This is a radial carpal collateral ligament. Radial collateral ligament here. We have the ulnar collateral ligaments here. Okay. These are the dorsal radiocarpal ligaments from the radius to the triquetrum bones. We have so many intercarpal ligaments. And on the dorsal side, see, it is more extensive on the dorsal side. We have the dorsal carpo-metacarpal ligaments. Okay, these are the dorsal carpo-metacarpal ligaments, and if you appreciate in between the base of the metacarpals, we have the dorsal metacarpal ligaments here. है ना? So this is they are forming a part of the intermetacarpal joints. Okay, this is how the joint cavities have been opened up. Okay, and all the joint cavities have been opened up in this image. Appreciate that. Please try to follow up this image very clearly. This is the inferior surface of your radius, right? The two separate shallow concavities. This is the annular articular disc of the radioulnar joint here. The articular disc, the inferior surface articulating with, this would be the scaphoid. See, this is the first digit. Okay, orient yourself. This is scaphoid, lunate, triquetrum and the pisiform, and we have the distal row here, trapezium, trapezoid, capitate and hamate, the hook of the hamate here. So we have this over here forming the radiocarpal joints, the scaphoid and the capitate, and this line over here in between the proximal and the distal row of the carpal bones. Can you follow it up here with me? This is the plane of your mid carpal joints. Okay, and this is the plane of how the joint cavity has been opened up in between your carpo-metacarpal joint. See, this is the first carpo-metacarpal joint and this the second carpometacarpal, third carpometacarpal, fourth and fifth carpometacarpal. Now appreciate one thing here, that is there is no one single articulation. One bone is articulating with different bones, right? Like I have capitate articulating with third metacarpal, I have capitate will articulate with the second metacarpal, it will also articulate with the fourth metacarpal to form the carpometacarpal joint. Because the surface of all the carpal bones, it is polygonal shape, there are numerous surfaces from which the joints are being formed. Okay, the radiocarpal joint which you have done, the intercarpal, in between the intercarpal means that the joints which are in between the proximal carpal row, and it is divided into joints which are in between the proximal carpal row and the distal carpal row, and then I have the carpometacarpal joints. Another entity that we spoke was the mid-carpal joint between proximal and distal. Okay. Again, this is a reiteration, you already know, I don't need to go into detail with the same. I've already shown you the slide. Okay. Coming to the intercarpal joints. The intercarpal joints, they connect the carpal bones with each other, as the name suggests. The joints of the proximal carpal row, they are in between the scaphoid lunate and the trichitrum, and pisiform forms a separate joint cavity with the palmar surface of the trichitrum. The dorsal surface of the pisiform will form a joint with the palmar surface of trichitrum, forming the pisiform joint. The joints of the distal carpal row between trapezium, trapezoid, capitate and hamate. The articular surface of all these of this joint can either be saddle shaped, can be ellipsoid or spheroidal. Right? Obviously, there are so many joints which are being formed, and I told before that the carpal joints bones are connected by an extensive array of ligaments. Okay. So again, this is the cut out, opened out joint cavity of the mid carpal joint. If you would open up the, can you appreciate that this is your carpal tunnel? If somebody would slit open through your wrist, if somebody would slit it open the mid carpal joint, a part of flexor retinacula is reflected on one side, a part goes to the other side. Okay. So the proximal and the distal rows, बार नहीं बोलूँगी how it goes, scaphoid lunate, okay, and see that's how the joint cavity has been opened. This image shows your flexor retinacula. Again, appreciate the flexor carpi radialis tendon. Okay. The mid carpal joint, see something, it is shaped here as S shaped. I'll talk about it. Okay, so the articular surface of the mid carpal joints are, proximally we have the scaphoid lunate and the trichitrum, and distally we have the trapezium, trapezoid, capitate and hamate. Now the mid carpal joint, there are essentially two compartments in the mid carpal joint. There is a medial compartment. Now appreciate that there is a medial compartment which is formed by the convexity formed by the head of the capitate and the hamate. Okay, this is from the distal row, we have the capitate and hamate here. Medial compartment, there is a convexity which is formed by the head of capitate and hamate, which fits into the concavity which is formed by scaphoid lunate and the trichitrum. Okay, this is actually a little, goes a little, why I highlighted this here is, it's a little arc here, you know, it somehow goes like this, ऐसे जैसे S बन रहा हो थोड़ा सा. There is a convexity here, but this follows a slight concavity on this side here. Okay, this is a medial compartment, and the lateral compartment wherein there is a concavity which is formed by trapezium and the trapezoid, and the convexity which is formed by the scaphoid bone. Okay, so we have the synovial membrane which is lining it, the synovial membrane of essentially all the joints. I had already told the main joint complex, that is how it is explained in Cunningham. They have a continuous joint cavity, and the ligaments which are associated with the mid carpal joints, they are the palmar and the dorsal carpal, and the medial and the lateral collateral ligaments. Coming over to the ligaments of your intercarpal and the midcarpal joint, this is again a zoomed in image of the initial image that we saw. Appreciate that we have the ulnocarpal ligament here, we have the radial carpal ligament which was here. These are the intercarpal ligament, the palmar intercarpal ligaments. You see here, these are the palmar carpometacarpal ligaments, okay, which are associated with this joint. On the dorsal aspect also, we have the dorsal intercarpal ligaments which are over here. I've already shown you about how it was the ulnar carpal collateral and the radial carpal collateral ligaments are, you have read yesterday also, the ligaments here, okay. This is a beautiful image from one of the dissection image. If you just force flex, I mean midcarpal joint, if you see, can you just flex your arm, sorry, just flex your hand. When somebody would slit open the midcarpal joint, when somebody would slip open the joint in between the proximal and the distal carpal bones from your extensor side, that is a dorsum, you are flexing. So I'm gonna, can you just come over to the camera? I've just turned on the camera again. This is forced flexion, okay. The forced flexion, if I would cut open, if something is dissected from here, from the dorsal side, okay, I'm cutting in through the midcarpal joint between the proximal and the distal carpal, then what would be here is, I'll have the carpal bones oriented like this. Now come see the image. This is the scaphoid, this is the joint cavity of the midcarpal joint. Can you see what would be the, I mean I said it has a medial compartment, it has a lateral compartment. This is a medial compartment which is formed by the convexity, which is formed by the head of the capitate. This very big over here is the head of the capitate, this is a hamate here. This is a convexity formed by the head of capitate and hamate fitting into the concavity which is formed by scaphoid. This is the scaphoid bone, lunate, and the trichitrum, okay. Scaphoid, lunate, trichitrum. This is a medial compartment and this is a lateral concave side. There is something very beautifully, can you see there is an in this dissection specimen, what do you think this is? What do you think this is? Let's revise. Can somebody tell? ये क्या कटा हुआ है यहाँ पे? Extensor. I said it is forced flexion. Forced flexion में जब यहाँ से काटेंगे, how would be the flexor retinacular cut? This is to the extensor retinacula, and there is an arrangement of your tendons. Can you see in this specimen beautifully? You can appreciate these tendons are arranged. Okay, this is your lateral to medial, yeah. Wherein we have the extensor, this is extensor carpi radialis longus, this is brevis, these are all the slips of extensor digitorum here, the extensor carpi ulnaris, the extensor digiti minima, and the extensor carpi ulnaris. Okay, see, that's how, see how beautifully the compartments are over here. Okay, so this is how the carpometacarpal, again coming over to the carpometacarpal joints. Can you just excuse me, I'll have a sip of water. Yeah. Coming over to the carpometacarpal joint. I've already shown you this in the image before, and I told that wherein we have the first carpometacarpal joint between the between the first metacarpal and the trapezium here. The other, there are so many articular surfaces are here. Okay. In the previous image, I said, see the capitate which is articulating with, capitate over here is articulating with the three metacarpal bones. We have the second, third and fourth, which I had already shown you. The second metacarpals will articulate with the three carpal bones. It articulates with the trapezium here, it is articulating with the trapezoid, and it is also articulating with the capitate. Appreciate the first carpometacarpal joint, it's a saddle shaped joint, and the second and the third carpometacarpal joints have interlocking surfaces, they interlock with each other. Okay. Coming over to the first carpometacarpal joint. We saw that the carpometacarpal joint, it's a saddle joint, it's a separate joint cavity. I already told you about what was a significant, because there is a continuous synovial cavity in between the first 4 carpometacarpal joints, the intercarpal joints and the midcarpal joint. They have one continuous joint cavity, that's a main joint cavity, but the joint cavity of the first carpometacarpal joint is a separate cavity, and also a separate cavity in between your pisiform and the tachytrum bone. Okay. As far as the articular surface is gone, it is between the base of the first metacarpal as well as the trapezium. If someone, I actually have I'll show you in the video also, but can you just turn on come over to the camera. Can you see the hand over here? This is the articulated hand. I forgot the probe. This is the articular hand. See the concavity, see the pisiform, the hook of the hamate. Alright. See, this is the trapezium and the tubercle of the trapezium here, and this is the tubercle of the scaphoid. Appreciate the groove that I was talking about on the medial aspect. Now see what I talked about when we talked about how the metacarpal, this is a palmar surface of the first to 4 metacarpals. Okay, it's a concavity, wherein this concavity in the first metacarpal is more, the palmar surface becomes the medial surface. That's how the first metacarpal is there, and the dorsal surface will be more lateral. Okay. Now why is this important? Why? Because we have so many different range of movements. Your hand is adapted to so many movements as such. One such movement is that you have to hold something, a grasp. Okay. The main movement that goes on with the thumb is opposition. Kuch pakdoge, then you have to oppose your fingers. Okay. Oppose the thumb to the palm. Okay. So that's how there is an angle which is formed. See here, there is an angle. There is an angle. मैं ऐसे दिखा नहीं पा रही हूँ. There is an angle which the plane of your first 4 digits and this form. This is positioned at roughly 60 degrees angle as compared to your hand. अपने हाथ में देखो. Can you try to see how the thumb is positioned with respect to the fingers? I hope that is clear. Okay. So this is roughly at an angle of 60 degrees with the fingers. This is the first metacarpal bone. There is a concavity. This is a palmar surface of the first metacarpal bone. This head, shaft and the base. Okay. In comparison to that, if you see the first metacarpal, sorry, this was a second metacarpal bone. I'm sorry for that. This is the first metacarpal bone. Why I got the individual bones? Just an idea to give you what a surface it becomes. It is a saddle joint between the surfaces of this is a trapezium and this is the first metacarpal. These are the joint surfaces forming the first carpometacarpal joints. There are ligaments which are attached to, I'll come over to the ligaments also, and they have their own synovial membrane which is lined. Okay. Basically this saddle joint, it allows movements in 2 cardinal axes. Just see the image here. Why are there 2 axes which are being formed? Okay. There is an axis for the abduction and adduction, and there is another axis. This axis, see, this is the first metacarpal just lifted away in the specimen just to show you what a saddle. So this is the trapezium and the first metacarpal, just to show you the surface or articular surfaces. The axis, the abduction and the adduction axis is more from the dorsal to the palmar side. This A axis will go from the palmar to the dorsal side, and the flexion and extension axis are 2 axes going from this axis passes, it is in a more transverse plane. I'll show the movements when I come. This is a highlighted image of the same. There are two axes around which the movements of the carpometacarpal joint are taking place. Okay, see that. There are two axes, the adduction and the abduction axis from the dorsal to the palmar side, and the trapezium, it's more of on a transverse plane. Transversely it passes through the trapezium. Again, as I told in our own palm, apna, just hold, normally keep your hand, this is a neutral 0 degree position. The neutral 0 degree position of the hand goes like this, that is, and then there are two axes which are shown. I'm just tucking. Okay. Okay. I said the can you just come over to the screen? Turn over to my camera as such. Okay. So when you talked about the movements of the hand, this is abduction, this is adduction, abduction, adduction, right? But the movements when it comes to the movement of the thumb is different. The plane where the movement of adduction and abduction occurs is different. First and foremost, that the ventral and the dorsal alignment I've already shown you. Why the thumb is positioned like this is to have the most prominent movement, which is the thumb and the hand is aligned to, that is a movement of opposition. I am opposing like this, okay? इसको facilitate करना है. For the movement of the adduction and abduction, the axis passes through here. This is how the thumb is adducted and this is how it is abducted. Firstly, if I have to talk about flexion, for flexion, keep your hand like this. For flexion, the ventral surfaces come closer. It is not like this. This is not flexion. The ventral surface approximate, this is flexion. See that. See in the second image in the PPT. The ventral surface is coming like this. This is how, this is flexion, and then extend, this is extension. This is flexion, this is extension. Can you see what, is everyone able to follow this, what I am trying to tell?
Yes, ma'am.
Okay, so this is flexion, this is extension. Now when you have extended your thumb, can you see something prominence coming up here? You are trying to highlight your anatomical snuff box. What are the boundaries of the anatomical snuff box? Come over, कुछ नहीं पढ़ा. We have extensor pollicis longus and we have abductor pollicis longus and extensor pollicis brevis here. Okay. Now, याद आया, when we talked about anatomical snuff box, we have the extensors which are following, the extensor pollicis brevis longus and abductor pollicis, right? So, I am doing extension here, okay. This is flexion, this is extension, this is flexion, this is extension. This goes adduction and this is abduction. This is passing through a more dorsopalmar axis and flexion extension is occurring at a transverse axis here. This axis, just follow my pen here, okay. The axis goes here. This is for the flexion and extension, this axis here. Alright. Now, the very important movement that a thumb is designed to is the opposition. Okay. Opposition is when the thumb come closer, when you try to touch the palm, the pulp of the thumb with the pulp of the little finger. This is opposition. Now, would you say that this is a little of flexion? When, sorry, not flexion. This is the opposition movement. Okay. I'll show in the image also. This is opposition. Okay. So, opposition movement is a mix of flexion and reposition where there is extension, flexion, adduction, medial rotation, everything. And one thing, sorry, I missed. Then when you flex, it is not essentially just the flexion. The flexion movement of the thumb is associated with a bit of medial rotation as well. Okay. I am flexing and I am also, there is a bit of slight degree of medial rotation as well, which is happening. So, it is just not the one movement which is happening, these are all conjunct movements, these are conjunct movements which are happening around the thumb. flexion, extension, flexion के साथ there is a slight degree of medial rotation, and when you extend there is a slight degree of lateral rotation as well. In opposition, okay. So come over to the PPT. So I have the adduction, which is facilitated by the adductor pollicis muscle, abduction by the abductor pollicis. So another thing, this is abduction, this is adduction, okay. Adduction and abduction. For the flexion, abduction muscles, we have abductor pollicis brevis and longus. For flexion, I have flexor pollicis brevis and opponens pollicis, right. Opponens Q, this was going towards that part. So flexor pollicis brevis, opponens pollicis. And extension, abductor pollicis longus, extensor pollicis brevis and longus. I hope you are clear now. Can you appreciate that in the image, how the flexion is supposed to be and the extension? Now opposition essentially is occurring through a third axis. This is a longitudinal axis. This is the axis for opposition, okay. This is the opponens pollicis. See, the pulp of the thumb is touching against the pulp of the little finger. What is this action? Is the opposition, and then when you get it back, it is a reposition movement, okay. So I have already explained you about what is the position of rest. Very clearly in the initial slides only I talked about that we have a slight degree of, come over to my screen again, I would like to highlight it. Yeah, this is a position of rest, okay. This position wherein we have flexion at all the joints, but that flexion is more in the little finger as compared to the index finger, and how your thumb is being placed. This is the position of rest with the wrist joint at some degree of extension at the wrist joint and variable degrees of flexion at the other joints. When you start to do some activity, I said that this is the rest, but when you start to hold a pen, any other activity, the angle, there is more extension occurs at the wrist joint. See, this was at rest. When I try to do something at rest, when I try to do something, it goes in a more of extension, isn't it? Okay. See in the slide now, see in the PPT again, we have the flexion of the thumb, we have the extension, adduction, flexion, extension. This is the image from the Snell's. Read about it from the Snell's as well. Abduction and the adduction of the thumb, and this is how is the opposition. Okay. If someone has some bit of doubt over the adduction and abduction, then I can tell again if you are not able to figure out how flexion and movements are different. Okay. So briefly I had already explained about what would the relationship of thumb to the fingers, that how the thumb and the fingers are placed. Okay, let me go again with the slide. Okay. Come over to the slide again, dear. Come over to where the movements have been told. This is, can you see the axis of the axis where the adduction and the abduction movements are happening is different from how the axis at the flexion and extension is happening. Okay, flexion may essentially flexion, how do you describe flexion movement is the ventral surface is opposed. So initial part when I talked about the skeleton, I explained what is the ventral or the anterior surface which has become more medial in the first metacarpal. So how the ventral surfaces would oppose is the movement happens from here to here, okay, from flexion to extension, but it was different from so
there is one thing which I would like to say.
Yes, ma'am.
Yes, ma'am. Somebody saying this is confusing. So always remember the axis around which a movement takes place is a perpendicular drop to the midpoint of the plane of movement. So if you understand the plane of adduction, abduction as in the anatomical position being sagittal, then almost sagittal, then obviously the axis is going to be, if the plane is sagittal, abduction, it is sagittal, so the axis will be transverse. And for opposition, the axis is a little confusing. I agree, because opposition, basically you are just bringing the flexor aspects, the pulp cavities over the distal phalanges of the thumb in approximation with the pulp of the over the distal phalanges of the other 4 fingers, other 4 digits. So for that it is difficult to define, except in terms of rotation around the long axis. Fine? So then axis will not be confusing. Please proceed.
Yeah. So as I said, the ma'am ने भी बोला है that the flexion and extension axis she has already explained. And for flexion again I would highlight that it is accompanied by, associated with a bit of medial rotation, okay, and similarly the extension is accompanied by some conjunct lateral rotation as well. For muscles, for flexion it was flexor pollicis brevis, opponens pollicis, which is assisted by, and it is also assisted by flexor pollicis longus. And for extension it is abductor pollicis longus, extensor pollicis brevis and extensor pollicis longus. Okay, so I don't think so I should spend more time here. Let's go ahead. Okay, and how the fingers are, how the thumb is related to the finger, that it is at roughly 60 degrees angle with the plane of the fingers as the thumb. Okay, so now this is interesting. You know why? If you just see that there is I just explained about a bit of longitudinal axis which is associated with the same. Can you just come over to the screen as well? Oh, can you just come over to the screen? See, this is the inferior surface, the base of the first metacarpal, and this is the trapezium. When there would be a bit of flexion, any kind of movement is happening at then the bases become incongruent. I told you, whenever it is trying to flex, it is associated with a bit of rotation. Can you see? The surfaces are not, they do not stay congruent with each other. Can you appreciate this thing here? How the metacarpal is going to rotate. In case of opposition, it is associated with a bit of medial rotation. The flexor is associated with medial rotation, and when the first metacarpal rotates over the trapezium, right? Can you appreciate this? Is able to see? Then in these are some of the potential areas, the potential areas how the stress is concentrated. It actually predisposes to early osteoarthritis, more function and more of this, and it predisposes to osteoarthritis, and this particular is also one of the disease associated, Cobb's disease, that is related here, is because of just a more of action around the first. Okay, so just summing up, we have already seen that before. It is from your Cunningham's itself. The flexion is called on all the joints by flexor pollicis longus. On the carpometacarpal and metaphalangeal joints, it is by the flexor pollicis brevis. And flexion is associated by opponens pollicis at the carpometacarpal joint. Extension is at all the joints is by extensor pollicis longus. We have extensor pollicis brevis and so on and so forth, right? For abduction, we have abductor pollicis longus and brevis at different joints where the action is happening. Okay. The for the second to the fifth carpometacarpal joints, I already told about how are the joints articulating. These are basically synovial ellipsoid joints. The articular surfaces being carpals and the second to the fifth metacarpal bones. Okay, and interesting thing when I had talked about was that if can you just try to keep your hand in the resting position again? Okay, just in the resting position, you see that the little finger can flex more as compared to your ring finger, then the middle, and from the radial to the unless side there is increased range of movement. when you see apna हाथ, just keep your hand in the resting position, just try to see that there is increased range of movement from the radial to the ulnar side. This is known as cupping. This is how somebody would hold a cup in the hand, as I told before, okay, at rest position. And even if somebody has a fracture in any of the, say if there is a scaphoid fracture or any carpal bone fracture as such, how a cast is also provided is in this position, is in the position of rest, okay. And in this rest there is increasing range of movement from the radial to ulnar side. This is essentially known as cupping, how you hold a cup in the hand. Or we say that when they apply a cast, when a cast is applied for such fractures and for reducing the not for reducing for the fractures, it is known as, it is applied in a glass holding or a cup holding position. A cast is applied because that is the best position how a hand is stressed without any undue action of the muscles or the undue stretch over the muscles or the ligaments, okay. The synovial membrane of the second to fifth carpometacarpal joints is continuous with that of the intercarpal joints, and the muscle producing movements, they are slight gliding movements only by long flexors and extensors. Again the similar image, but what we have here is that I have the palmar carpometacarpal ligaments on the palmar aspect, we have the dorsal carpometacarpal ligaments on the dorsal aspect, okay. The intermetacarpal joints, the articular surfaces are the second to fifth metacarpal bases, which articulate reciprocally by small cartilage covered, and the covered facets connected by, and these articular surfaces, they are connected by dorsal palmar and the interosseous dorsal metacarpal, palmar metacarpal and the interosseous ligaments. Fibrous capsule is present in the synovial membrane, as we said already highlighted a number of times, it is continuous with that of the metacarpal articulations. We have the dorsal and palmar ligaments. An array of ligaments stays almost the same, and movements which are permissible at the carpometacarpal and the intermetacarpal joint, they are slight gliding movements, they are associated movements, the carpometacarpal movements and the intermetacarpal movements, joint movements are gliding movements. Okay, coming over to the joints of fingers, we have this is a representative image, you know what joints we have. For the metacarpophalangeal joints, the articular surfaces are the head of the metacarpal with shallow concavity on the phalangeal basis, okay. The base of the proximal phalanx is or in case of your first metacarpophalangeal, the metacarpophalangeal joints, we have articulating with the concavity on the phalangeal base, okay. The fibrous capsule in the metacarpophalangeal joints, when we describe, we say that it is basically a thickening, thickened it is anteriorly to form the palmar ligaments. See in this image, the capsule only is thickened anteriorly to form the palmar ligament, which is also known as the volar plate. These are the palmar ligaments, as also described as a volar plate, and on the laterally we have the collateral ligaments, okay. There are two collateral ligaments, the collateral ligaments from the metacarpal, from the dorsum of the metacarpal going towards the base of the proximal phalanx, and the joint cavity anteriorly is covered by this palmar ligament, also known as the volar plate. This term will be used again, the volar plate, and this collateral ligament has basically two parts. It has a cord like part which from the metacarpal goes up till the base of the phalanx, and it also has a fan like part, okay. And you already know about that we have the deep transverse metacarpal ligaments also. Appreciate this, this is the head of the metacarpal, and this is the base of the phalanx. This is the collateral ligaments here, okay. This is a collateral ligament shown here. Joint movements which are permissible at the metacarpophalangeal joint, there are all flexion, extension, adduction, abduction, circumduction, as well as limited rotation as well, which is permissible. The flexion at the metacarpophalangeal joints, obviously we know that the tendons which are crossing the joint cavities, we have the flexor ditorum superficialis, profundus, assisted by all your small intrinsic muscles of the hand, that is your lumbricals, interossei, muscles of the other muscles as flexor distae minimi, pollicis longus and brevis, all the interossei for the thumb. For extension, we have extensor digitorum, indices, extensor indices, extensor digiti minimi, extensor pollicis longus and brevis. For adduction, we have palmar interossei, the long flexus, adductor pollicis, and the first palmar interossei for the thumb. And for abduction, we have the dorsal interossei, abductor digiti minimi, and abductor pollicis brevis. Okay. So the ligaments, now see over here, I said in the initial part of the class that the ligaments which are associated on the palmar aspect are similar for the metacarpophalangeal as well as the interphalangeal joints. Okay. See, these are the palmar ligaments. Palmar ligaments, also known as the volar plate. This is a deep transverse metacarpal ligament. Deep transverse metacarpal ligament, very clearly seen in this image as well. If you see in the dissection specimen, this is the volar plate or the palmar ligaments. Okay. Yeah. And on the dorsal side, you can see from the sides, these are the collateral ligaments. You can see the collateral ligaments from here. Okay. Interphalangeal joints, they are basically the uniaxial hinge joint variety. We have the capsule present as here, as well as a synovial membrane. The similar thing, we have the ligaments are similar for metacarpophalangeal and the interphalangeal joints. Appreciate that these are the collateral ligament, and sometimes we have also the accessory collateral ligaments also present. Don't go into the A3 pulleys and cruciate, you don't have to go into so much of detail about the same though, I'll tell you about it. This is a palmar ligament, also known as a volar plate. Okay. Pulleys are, all the tendons, they are held in position in the digits as such. So they have a pulley like action. The number A1 to A5 pulley, we call them as the pulleys here. A is for annular pulley, C is for cruciate. Can you see the cross thing which is being happening? These are the cruciate pulley structure. Okay. Similar thing, the ligaments and all seen from the again the repetition. We have a cord-like part of the collateral ligament, a fan-line part, and this is a palmar ligament or the volar plate, palmar ligament. Similar structure with all this. We have, this image shows a flexion at the proximal interphalangeal joint, flexion at the proximal and the distal interphalangeal joints. Okay. This is a little detail about the same, what I showed you in this image. Can you appreciate how the ligaments are disposed here? We have the deep transverse metacarpal ligaments first and foremost, that is being seen. The ligament, they are disposed as the annular ligaments around the joints. We have the annular ligaments and we have the cruciform ligaments, the annular and the cruciform ligaments. Okay. Do not go into so much detail about the same though. Okay. Just appreciate, this is the proximal interphalangeal joint, this is the distal interphalangeal joint. The ligaments are strengthening as the annular and the cruciform ligaments here. It is keeping the tendons of flexor digitorum superficialis and profundus, they are passing deeper to it. This is a tendon of flexor digitorum superficialis. Can you see the splitting into two slips here to attach to the laterals of on the sides of the middle phalanx here, and deeper plane is the tendon of flexor digitorum profundus going deeper to get attached to the distal phalanx. This is just, I don't know if you should not be going into so much detail. We have annular ligament A1 to A5 at the level of the different joints. At the level of metacarpophalangeal joints, it is on the proximal phalanx is the second, on proximal interphalangeal joint, on the middle phalanx, and also at the level of distal interphalangeal joint.
They don't require, these are actually, this is the fibrous flexor sheath, the different
Yes,
parts
ma'am.
of the fibrous sheath. So they don't require so much detail. Even
Yes.
postgraduates will know these things. But of course, it's not a continuous sheath. This is just to give that perspective that it is not a continuous sheath, but it is like this, so that to allow movement at the joints, it has to be a little less rigid in the region of the joints. That's how it is organized. You don't need to memorize all the different parts of the fibrous flexor sheath. You can go on.
So when we talk about the movements of the hand, I'll be talking into the basic different type of grips that are seen. We'll talk about the movements in this. We have a pinch grip or a precision grip when you're holding something between the two, with the tip of the two fingers, two digits. There's a power grip when the whole hand you are attaching, right? We have the pinch or the precision grip. We have the power grip. And you see different joints are moving here. We have the key grip, and it is described as the hook grip as such. Okay. Okay. The various functional positions of hands which are assumed here. This is almost similar to here, but again highlighting this is somehow what a rest position of hand is, little more closer. Okay. This is just to show you that how this is a cylindrical or the power grasp as such, where you are holding something, all the joints are flexed, the wrist joint is extended. In the cylindrical in the power grasp, all the joints are flexed, you are making a fist around it. There's a flexion, there's a slight extension at the wrist joint with flexion at the metacarpo and the metacarpophalangeal and the interphalangeal joints. You have the hook grasp, wherein it is something you're holding a bag. Okay, there is extension and there is a wrist joint extension. Okay, so these are just to show that how the loose grasp, the fingertip pinch between the two hands. Okay, pinch grasp or the precision grasp between the two can be varied. You can have a little almost opposition of two fingers with some gap in between the two fingers. Okay. Okay, these are the movements what you would see at the movements of hand at the radiocarpal and the midcarpal joints. Can you see that when you are holding the hand, can you try to do that on your own hand when you extend your hand dorsally, and when you try to extend your hand, this image is showing the range of various movements. If you do a bit of dorsal extension, you are just able to extend to 40 and 60 degrees only. Okay, but when you flex, when you do palmar flexion, when you put your hand down, it goes on it has a more range as compared to how you can take your hand on the dorsal side. When you do the dorsal extension or palmar flexion, the range of palmar flexion is more as compared to dorsal extension, and the amount of ulnar and radial deviation, always say adduction and abduction, how we describe. On the ulnar side, you can deviate more as compared to the radial side. Wherein see this is how, the flexion at the metacarpophalangeal and flexion of the interphalangeal joints forming a fist. This is showing the extension of the metacarpophalangeal and flexion of the interphalangeal joints here, and the extension of the metacarpophalangeal and the interphalangeal joint. Okay, when we describe the movement of the fingers, see this image very clearly showed that how well you can. I want you guys to do this, how this is being shown in this image. You can, at what range, what is the range of motion of the finger joints, you can flex it, the distal phalangeal to almost 90 degrees, and proximal interphalangeal to how long, how much that angle which it can be forced. No need to go into so much of detail though, but when you extend your fingers, when you extend your all the digits, you still have an angle of 10 degrees. The distal interphalangeal joint forms an angle of 10 degrees. It is, it does not go like this. It is not lying at this level. Appreciate your nail bed going a little up. This is a roughly little angle of 10 degrees formed in all the movements. This is the axis of the hand shown before. We have adduction and the abduction. You know about this range of motion and how what would be the adduction and the abduction. Adduction facilitated by your palmar interosseous, and abduction by your we have already dealt about the muscles. And for describing the movements of the fingers, flexion at all the joints in the digits is by, obviously it can be done by flexor digitorum profundus, and at flexor digitorum profundus causes a flexion at all the joints. Flexor digitorum superficialis is called metacarpophalangeal and proximal because it is attached to the sides of the middle phalanx. It does not cause any movement at the distal interphalangeal joint. At the metacarpophalangeal joint only, flexion is caused by lumbricals and interosseous. They cause flexion only at the metacarpophalangeal joints. Similarly, the flexor digiti minimi causes carpometacarpal and metacarpophalangeal joints of the little finger, and opponents similarly for the carpometacarpal joints. The extension caused by extensor digitorum, extensor indicis, digiti minimi. This is a reiteration of how you have already done about the extensor compartment and the attachment. Okay? And extension is called by lumbricals and interossei at interphalangeal joint when the metacarpophalangeal joint is fully extended. Similarly, about the abduction, about the dorsal and the abductor digiti minimi and the little finger, about the adduction, the palmar interossei, and opposition at joint is formed by the opponent's digiti minimi. Regarding the vascular supply of the joints, we have the carpal joints are supplied by the posterior carpal branches of the radial and the ulnar artery, the anterior interosseous artery. For the carpal metacarpal joint, the thumb is supplied by the radial artery as first dorsal metacarpal branch, and from the second to fifth carpometacarpal joints it is by the radial and the ulnar artery, the posterior carpal branches, and the anterior interosseous artery and the palmar distal arteries. The metacarpophalangeal joints by the palmar metacarpal arteries, and also the arteria princeps pollicis and radialis indicis that you have read about, the interphalangeal joints by the digital arteries. The thumb, carpometacarpal joint, the thumb is supplied by the posterior interosseous nerve. Is a branch of, it's a branch of what? I think everybody is tired now reading about the so many joints and movement.
Radial nerve.
Yeah.
Radial nerve.
Yeah. Posterior interosseous. Yes. The posterior interosseous nerve and superficial branch of radial nerve, and also by the second and fifth joints may we have the ulnar nerve, the anterior interosseous nerve, the superficial radial and dorsal ulnar nerves. You can read all that, you know. Metacarpophalangeal joint by the branches of median and the ulnar nerve, and deep terminal branch of ulnar nerve, posterior interosseous nerve. Similarly for the interphalangeal joints by the palmar distal branches of the respective. Yeah. So this was not exactly a brief about the joints of the hand. Let me show you the videos that we have here. Okay. This is just an orientation of the skeleton of the hand. The dorsal surface we have, and the palmar surface we have the concavity here. I would be highlighting about these are the carpal bones, the metacarpals and the phalanges. Appreciate the carpals arranged in a proximal row and the distal row. Scaphoid, lunate, trichitrum pisiform. This is trapezium, trapezoid, capitate and hamate. Did you see that this is the tubercle of the trapezium, this is the tubercle of the scaphoid, and this was a groove here, medial here, that I was talking about for the tendon of flexor carpi radialis. Pisiform and the hook of hamate forming the ulnar arch, and the tubercle of the trapezium and the scaphoid form the the radial elevation. The metacarpal joint, highlighting about the carpometacarpal joint. I already showed you most of it when I showed you the skeleton of the hand as such. This is again that I highlighted. The palmar surface of the metacarpals shows a concavity. This is how the hand is positioned, forming a 60-degree angle here. Okay, so I was highlighting the same. This is to facilitate this palmar surface becomes more medial. This is to facilitate how you would oppose Okay. Sorry, this is how the first metacarpal and the trapezium forming the carpometacarpal joint. The saddle shaped, it's a saddle shaped joint, and these are the different other carpometacarpal joint. So, and you understood what I told was that this is one main joint complex. Okay. Pisiform and trichitrum separate and the carpometacarpal separate. Rest of all the joints over here, they form one main joint complex because they have the continuous synovial lining. The synovial membrane extends till here in between the metacarpal bones. It's talking about the midcarpal joint here. Can. Metacarpophalangeal joint linings.
So Dr. Vidya, ma'am, show the videos and I think that's it.
Yes, ma'am. Ma'am, I'll just...
Just show the videos, yes. Because the first carpometacarpal, you have it dissociated. That will give them a perspective about, the shape, saddle shape of the joint surface.
Yes, ma'am.
You have a dissociated, right.
I was showing about how the metacarpal palmar surface and dorsal surface is. This is shorter, more stout, thicker bone as compared to the other. Palmar is medial.
The movements of the thumb make sense if you understand that the plane of the thumb is at 90 degrees angle to the plane of the other fingers. That's basic. And so the movements are going to be 90 perpendicular. The plane of movements of the thumb are going to be perpendicular to the plane of movements of the other fingers. And now the saddle shaped surface.
Appreciate the surfaces here.
Yeah.
So this image, this is the dissection video from our this thing. See, we have the digits here, the first from the fourth, understandable. Can you appreciate the long tendons, long flexor tendons here? This dissection was done on an old specimen, not a fresh one. We tried to show as much as it can be shown here. This is what he's trying to show here is the level of the wrist joint here. This is the region of the intercarpal joints. Okay, the flexor retinacular has been cut. We have the flexor tendons. The carpometacarpal joints, the metacarpophalangeal joint, and over here the interphalangeal joint. After reflecting the skin here, see, this is the cavity of your first carpometacarpal joint. Base of first metacarpal with the trapezium. Lost some focus here. Thickened capsule of the joint.
First carpometacarpal joint can come as a short question. It's a very favorite question. So the shape of the articular surfaces you talk about the type of joint, then you talk about the various movements, and then you talk about the muscles doing those movements. So first carpometacarpal joint, please study. In detail, the others are not so important. Radiocarpal, of course, and then the first carpometacarpal. The others are more or less sliding line adjustments, except the metacarpophalangeal joints, which are again biaxial, and you abduction, adduction, with the long axis in line with the middle finger, third digit, and then the interphalangeal joints, which are basic hinge joints, flexion extension movements only. And the first carpo-metacarpal joint is a saddle variety of joint. It has free movement, flexion extension, adduction, abduction in two perpendicular planes, and limited movement also, rotatory movement, which makes opposition possible. Circumduction is not a separate movement, it's combination, so it is not considered to be a third movement, but opposition is. So that's what qualifies it as a limited multi-axial joint. We had that discussion about whether to include saddle variety of joints as biaxial or multi-axial. It is multi-axial because movement is possible in more than two planes around more than two axes. Although the third one is limited. In comparison to ball and socket, where three orthogonal axes means mutually perpendicular axes, movement is free. It's not limited in the ball and socket.
So over here showing the metacarpophalangeal joint. Appreciate the head of the metacarpal. This is the third metacarpophalangeal joint. See the thickened, these are this is the capsule, right, in the metacarpophalangeal joints. The surface is the articular.
Articular cartilage looks very smooth and glistening.
Yes, ma'am.
When joint cavity. So that is a special variety of cartilage. Always they look smooth and glistening.
See, this is your interphalangeal joint.
Right.
There is one more video. That's for it now, ma'am.
No, also. Yeah. Okay. Any questions they can ask, otherwise we can close the meeting.
I think they're already leaving. They're leaving, ma'am. No questions as such. All right. I would expect that you have a revamp of, though I highlighted a bit about the muscles and all that in this class as well. But go back and read about all the structures, because next week probably we will have the revision class. You'll have your nerves and lesions and all that. So you should know about the structures again. Okay. Should I close the meeting, ma'am?
Thank you. Yes, please do. Thank you.
Bye-bye.
सारा कुछ मैंने करा था, नूडल्स वगैरह का नीचे।
अरे थैंक यू। आप यहाँ से ऊपर आ गए आप?
हाँ नीचे से ऊपर आ गया, ठीक है।
थैंक यू भैया।
चलो ऊपर।
मुझे शक्ल देखी हुई लग रही थी।
याद नहीं आ रहा था।
हाँ शक्ल देखी हुई लग रही थी, मतलब एम्स में होता है ना।
हाँ मतलब इतना सब लोग मिलते हैं, ठीक है।
थैंक यू।
ओके।
आप फैकल्टी भी बन गए।
हैं?
मैं कहा आप फैकल्टी भी बन गए हो।
चलो मुबारक हो, कॉन्ग्रेचुलेशन।